Hello and good evening to all. We are very happy to welcome you to this special session on COVID prevention and control for institutional safety, employee protection and self-care. My name is Meera Dalvisani and I'm the Regional Director of the IGCC Pune office. I would also like to extend a very warm welcome to our knowledge partners for today. Dr. Ranga Reddy Burri, the President of the Infection Control Academy of India, an advisor at the Indian Institute of Public Health, and Mr. Shiva Kabra, Joint Managing Director, Control Print Limited, and founder of the Lab Mask. Thank you very much for this association. Dr. Reddy is a health policy enthusiast with a focus on public health awareness, education, and training. Doctor has received his degree as an MD physician from Belarus and has advanced degrees from the Pondicherry University and IESE, Spain. Shiva is the Joint Managing Director at Control Print, where he has been involved with overseeing the strategy, marketing, and business development functions for over 15 years. He has also founded the Mask Lab, a company that creates best-in-class, internationally accredited masks that are made in India. Shiva is a graduate in economics and mathematics from the Grinnell College in USA and holds an MBA degree from Incidence, France. As offices reopen and we start to set out, there are some crucial precautions that we must take as individuals and businesses. In fact, it is even more crucial now as several places are experiencing a stronger second wave of cases. So Reddy and Shiva will share insights on global best practices and give expert tips on how to keep yourself and your employees safe as lockdowns ease across the world. Let us understand what the best protections are, how to choose the right mask, and how we can ensure our own safety as well as that of people around us. So do note, we will have a Q&A session at the end, and participants can post their queries in the chat boxes on the right-hand side of their screen. I request everyone to kindly post clear queries so that we can give you the best possible guidance. Thank you so much for your cooperation. Now, before I invite Shiva and Dr. Reddy to start their address, we would like to run a quick poll to get some food for thought and also to get the discussions rolling. Can we have the first poll question, please? So everybody can just choose their response and we will have the answer once everybody is done. Sana, do we have the poll response? Okay. So Shiva and Dr. Reddy, I mean, the floor is yours now. You can, analyze the responses that we've received for this question. Thank you.
Sure. Shiva, you're going to start, right?
Yeah, absolutely. So first of all, I'd like to thank everyone who's joined today's webinar, and thank you to IGCC for taking this initiative and giving us this platform. 2020 has been dominated by COVID. As managers, ensuring the safety of our colleagues and surroundings is paramount. At Control Print, we are an essential services ancillary company and critical to the manufacturing operations of many types of companies, including Unilever, Tata Steel, Ferrero, and others. Our printers require constant servicing and hands-on assistance to ensure that the manufacturing lines of our customers are not disrupted. Therefore, a large majority of our 700 employees continue to work from the field and factory and cannot resort to work from home measures for safety. As managing director, I'm responsible for the health and welfare of our employees, and I have been required to enforce practices for their protection. Since the beginning of this pandemic, we have not had a single case of contamination within our workforce, which is I'm very thankful for. We understand clearly that several companies and workplaces must carry on working. The pandemic will continue for at least a few more months, and we have to learn to live with the virus and the restrictions it places on us. And that brings us to the objective of today's webinar. Since the beginning of the pandemic, there has been new research and information on the virus and its spread. So we would like to inform you and update you on this new information regarding the virus and clear misconceptions on the virus from the past. And that's why we've also got Dr. Reddy to apply recommended best practices to curb the virus and ensure that we as managers can provide the safest workplace for our employees. There are also some very useful handouts in this webinar, which I strongly recommend downloading for all of you on board right now. And without further ado, I'd like to welcome the esteemed Dr. Reddy, who will share his expertise as the president of the Infection Control Academy of India. Over to you, Dr. Reddy.
Thank you very much, Shiva. Thank you, Meera. Thank you all who are participating today. Ladies and gentlemen, I hope you and your families are safe and your workforce is safe, and I'm sure they are going to remain safe if we are going to take proper precautions. I would like to thank the today audience, predominantly coming from Indo-German Chamber of Commerce, and also a big hi to all the alumni of IASC today who have taken their time out to participate in this webinar. Just a couple of minutes back, there was a quiz or a question which was asked. How long do you think this COVID is going to last? I saw a lot of optimism in the answers. Most of you have given the answers saying that probably by mid 2021 we would be done away with that. Let's hope. I share your enthusiasm and I share your optimism about the timelines, but unfortunately it may not be realistic to imagine that the current COVID-19 pandemic is going to leave us so soon, like mid of 2021. In fact, we are witnessing some unprecedented times as the whole world is grappling with the onslaught of a virus, which is probably unknown to the humankind. At the current case rate of about 30 million and the fatality rate of approximately about 1 million, to be precise, probably it is something like 900 plus thousand, is quite a challenge for our modern medicine. To all of us who are in the public health and in the clinical sciences, it is quite a challenge to look at that kind of fatality rate. It is sad also to look at these kind of numbers. As we all know that in the past, the pandemics usually occurred only in the time of political, social, or economic changes. Example, if you take go into the history of maybe the earliest of the recorded times, like 13th century, you know that the Mongols have conquered and unified Asia, Middle East, and Europe, which has facilitated the Black Death. Black Death is nothing but bubonic plague. I intentionally am not using the scientific terminology, but I am going by more of layman term, that is Black Death, which is a very famous term which is being used by most of the common people. If we come to let's say Spanish flu, which is known to be the biggest pandemic probably ever humanity has seen, where about 50 million people have died. In 2018, just 2 years back, a century has passed since the onset of the Spanish flu. But unfortunately, even after 100 years now, our ability to deal with the pandemic is still not very, very effective. If you look at the current pandemic, COVID, we woke up something like in February, March, with usual confusion, panic, chaos, and also, we have delayed in recognizing the severity of the outbreak which has happened in China. There are multiple factors. I'm not going to go into that. Especially, I would not actually go into the areas of politics because currently in the world, when we are dealing with the health emergencies, sometimes, unfortunately, more than the concern for health, the economics and politics are taking over. That is why there was a delay in terms of declaring it as a public health emergency, then subsequently declaring it as a pandemic. In fact, in December, we as people of public health, we very strongly recommended World Health Organization to immediately declare in December itself a public health emergency, but unfortunately it has gone into the deaf ears, causing a lot of fatality and also the delay in terms of actions which would have taken in order to prevent that large scale of transmission what we are witnessing today. We knew very well that when MERS and SARS and H1N1 was happening, and we as public health specialists and also the various organizations who work in this sphere, like World Health Organization and many other organizations, are in know that there is another health emergency around the corner, which is probably going to hit us very, very soon, and it is going to be zoonotic origin. You know that most of the recent outbreaks, epidemics and pandemics, they're all of zoonotic origin, and this is happening because of the human activity, I would say, that destroying actually the kind of space which otherwise would have been used by the animals. We are conquering those places. We are destroying the places, or the habitats of the animals, and hence actually the viruses which are microbes which are usually in the alm of the animals are jumping into the humans and human habitats. If I had to quote, from 1947 book, The Plagues by Albert Camus, let me, read it. Quote, everyone know the pestilences have a way of recurring in the world, yet somehow we find it hard to believe in ones that crash down on our heads from a blue sky. There have been many plagues as wars in history, yet always take people by surprise. This is what Albert Camus has written in his famous book called as The Plagues in 1947, and it is a reality even today. The current health crisis is alarming, in part because it has several new and unfamiliar features which otherwise are not known actually to the medical fraternity especially. It is a global medical emergency which is caused by a virus which unfortunately we still do not fully understand. The world probably would look significantly different this time post this pandemic as we emerge from this crisis, if we decide to take action to resolve these problems when I say the delay in communication and removing actually the politics and economics from the concerns of the health and bring about a fundamental change in the way how we are going to look at and how we are going to respond to the medical emergencies or public health emergencies of international concern. Either they are the outbreaks, they are the epidemics or pandemics. The world after COVID-19 is very unlikely that we would return to the world that was. Many trends have already underway in the global economy. Today I'm also actually mentioning economy because today we cannot separate the health without actually economy, and hence the health of global economy is also going to have its own kind of imprint on the global public health. And hence, when we see these changes which are already underway and are being accelerated by the impact of the current pandemic, we see with a lot of alarm, right? So, having said all what I had to say about the current pandemic and also the negatives of it, but at the same time, we as a society, we as a globe, we as international fraternity, we need to move on with our lives. Locking, ourselves is going to be very ineffective, and probably, it may cause even damage. Damage both in terms of health, damage in terms of economy, damage in terms of actually the long-term chronic diseases, especially the mental disorders, right? So it is the time that we open our schools, our clinics, our offices, our industries, and all that matters while ensuring abundant precautions in order to avoid escalation of current pandemic. But at the same time, the time has come, when we had to remove all these lockdowns and isolations. Fortunately, most of the countries have realized the futility of just locking down, and hence actually they are slowly but steadily, with a lot of abundance of precaution, they are opening, which is a good sign. And at the same time, in order to normalize our lives, we need to better understand the virus, better understand actually the transmission, and also better understand the management of the disease, right? Because as you know, that even today we do not have a concrete protocol in order to treat COVID-19, right? And probably I had to confess here that we still don't fully understand neither the virus nor the infection it is causing. We probably are at least a year away from the vaccine, and the best way in the meantime to protect ourselves, to protect our factories, to protect our communities is to take precautions. So precaution is the only way forward till the vaccine is going to come. I'm going to talk a little about the vaccine a little later, but let me tell you that vaccine is not a silver bullet. Vaccine is not a panacea in order to resolve our issues and come out of this pandemic. Although there are more than 350 candidates from all over the world, and at least 40 of them being in various stages of clinical trials, either clinical trial phase 1, phase 2, phase 3, or even in post-marketing trials level. But still, they are not, even when actually the vaccine is going to be approved, which is efficacious and at the same time which is safe, it would take a long time before our 8 billion population all over the world is going to get their chance to get vaccinated. I also mentioned in several talks earlier that the vaccine with the kind of protection it is giving. Means if you look at all the 40 vaccines which are in the different stages, they are claiming actually to give a protection for a period of anything like 6 months to 1 year. That means if you are going to get vaccinated, means you would have a window of about 6 months to 12 months, which is the protection period. That is not something which is going to really set us into or normal life. That means every 6 months we had to again go and again get vaccinated, etc., etc. And for resource limited countries, right, or low or medium income countries, it is going to be a huge economic burden if we are going to do the vaccination every 6 months. As you all know, India has got one of the largest vaccination programs, the childhood vaccination especially. If you look at the BCG, measles, etc., etc., they give a lifelong protection. That means, whatever the government is going to invest into that kind of vaccination, it gives a very good dividend over a period of the lifespan of one citizen. That's why, it is worthwhile to invest into that kind of vaccination. But when it comes to COVID vaccine, which currently is still in the clinical trials, if it is going to provide a 6 month to 1 year window, it would not be worthwhile to invest even otherwise a very limited kind of healthcare budgets we have to give that money towards the vaccination of the populations. So, how do we then deal with that? When I say the precaution is the only way, what do I mean? What do I mean is when we talk about precautions, I primarily talk about infection prevention and control, which is at both the healthcare settings level, but also at the community level, right? What is infection prevention and control? It is nothing but a set of evidence-based practices and procedures, which we follow in hospitals, clinics, wherever we provide a service to the patient. That is where we follow these evidence-based practices and procedures. This can be applied in communities also. And in addition to infection prevention and control, there is a program called WASH, right? That is water, sanitation and health. This is a program which deals with the sanitation and the hygiene in the communities. So when we talk about infection prevention and control, we talk about the standard precautions, right? So what are the standard precautions? Standard precautions are, as I told in the previously, that it is a set of evidence-based practices and procedures like hand wash, personal protective equipment, routine cleaning of high-touch surfaces, cleaning of the spills of body fluids, either it could be blood or it could be urine, stools, etc., etc. Safe handling of the needles, safe waste segregation, because there is a lot of waste, especially biomedical waste, which is being generated in the healthcare institutions, and even otherwise also in the public or communities. We generate a lot of waste which have to be safely segregated. And then finally, the disinfection and other related areas like sterilization, etc., etc. These are all called as standard precautions. And then we have got additional precautions based on the transmission of the disease, because each disease has got its own transmission pattern, right? Based on the transmission pattern, based on how the infectious, what is the infectious agent, how it is entering or exiting the human body, then the host susceptibility. That means there are people who are more susceptible, like the old people, pregnant women, those who are immunodeficient, etc., etc. they are more susceptible for the kind of infections. So these are additional precautions based on these parameters which you take. So when we talk about the precautions based on transmission, they are primarily two kinds. Either they could be direct or they could be indirect. When we talk about the direct transmission, right, it is either it can be a contact or it can be droplet, right? What does it mean by contact? Contact is when there is a respiratory discharge or feces or fluids, foods, or just simple greetings like handshaking, kissing, etc., etc., right? Because some of the nations have got the habit, or some of the cultures have got the custom of kissing as a greeting, right? So during this contact, there is a possibility that the infection is transmitted, or the kind of infectious agent is transmitted from one person to the other person. And then there is something called as droplet, right? What is droplet? While now I am actually delivering this talk, although it is not visible, there are thousands and probably lakhs of small particles which emanate from my mouth, right? So these are all usually the large nuclei spread within 1 meter by coughing, sneezing, talking, or doing some kind of medical procedures. For example, your dental procedures is an example, or doing intubation, bronchoscopy, or etc., etc. These are all the procedures during which these large nuclei can spread within 1 meter. Usually they are big enough not to actually travel too much of distance, and they very quickly fall onto the floor or wherever, or if you are standing near a table, they fall on the table, etc., etc. Then there is a indirect way of transmission. What is indirect? Indirect is basically airborne. When the droplets, which are going to be very fine droplets or dust with infectious agent, they get evaporated or aerosolized by the process, and they they usually travel a longer distance than 1 meter. For example, maybe just to make you understand better, giving an example of something like probably influenza, right? Or TB, tuberculosis, which is a very big scourge for India, right? We have got world's largest number of patients with tuberculosis, both open and non-open. So when there is an active tuberculosis patient, when they are going to actually talk, etc., etc., through this airborne transmission, they can actually infect the people around them. Luckily, probably it may be a little diversion from the topic, but let me just very quickly mention about it. It could be probably of interest to you. That during one of the silver lines of current COVID-19 is that because there is a kind of universal masking, we are able to actually reduce the incidence of tuberculosis infection among Indians. We do not yet know exact numbers. Probably in a couple of months we would know. When there is a lockdown, when there is isolation, we would not be able to pinpoint actually these numbers. But I think in about 2 to 3 months' time, we would be knowing what had been the positive impact of this universal masking on some of the very big diseases like tuberculosis in India. So now coming back again to the COVID, as far as COVID is concerned, it is a direct transmission, right? It is a direct transmission through droplet or contact. Droplet, that means when somebody is actually talking to you within the distance of 6 feet, or when somebody sneezes, within that distance what I have mentioned, or when somebody is laughing loud, etc., etc., before you, etc., etc. So in those cases, those droplets actually can enter through your orifices in the face, like your eyes, your nose, nostrils, and your mouth, right? Because that is where you have got this mucous membrane. They just go and stick there and start actually proliferating and cause the infection. And the contact is when a person who is coming to your office or your home, that person stays actually, let's say, that prescribed distance of 6 feet, but they have sneezed or they have coughed in your premises, and those droplets have actually gone and sat on your table or your premises, etc., etc., and then you go and touch that area, and through actually the kind of direct contact, you would be getting that into the hands. And usually we always have the habit of actually touching the nose, ears, eyes, or the face, and we actually transmit through our hands the infection into our body. So how do we go about breaking this transmission, or we call it as breaking the chain of transmission or the chain of the infection? The best way, you had been hearing from a lot of people through TV, through WhatsApp, university. I would call it as university because there is so much actually being talked nowadays on the social media. You got this information. There are three things what people always had been emphasizing on, especially during this COVID time. That is social distancing, but at the same time, I would not agree to the terminology of social distancing, because social has got a different connotation. As a public health specialist, I will call it as physical distancing, because we are keeping from each other a certain distance, physical distance, and hence I would like to call it as a physical distancing. And the second one, the hand washing, and the third one is masking, right? All these three are very, very, very essential and very simple steps to prevent the transmission of infection. It is also evident that usually the people, are infectious for at least 48 hours before symptom onset, because as you know that there is something called as incubation period. Means from the moment actually the virus has entered a particular person's body, till actually it manifests as a symptom, it takes some time. That is called as incubation period. That is about 48 hours, right? In the case of coronavirus or the novel coronavirus. So, during that 48 hours, we usually call it as pre-symptomatic period, right? And some people after that or during that period may have also, only minor symptoms, which we call it as symptomatic, right? And others, maybe about 20% as of now, that is what we see, entirely may remain asymptomatic. Means they would not manifest with any of those things what we typically call as the symptoms of COVID, like fever, body aches, headache, like the nasal kind of secretions, etc., etc. You may not see any of these symptoms which we typically call as COVID symptoms. And that is why these individuals, especially those who are asymptomatic, can transmit the virus without knowing that they are infectious. Not only asymptomatic, but even those who are in pre-symptomatic or passive symptomatic phase, they also can transmit during these first 48 hours without knowing that they are infectious. That is why there is a very strong argument for use of face mask as a source control. What is source? Source is that human being, right? So if you are going to mask, if you are going to face masks, then that source can be controlled in terms of transmission. In addition, there is also a big disagreement and debate which is going on, which goes on also about the risk of transmission through aerosolized SARS-CoV-2. These perceived conflicts in turn continue to fuel the conflicting advice sometimes about the potential role and type of face masks which are to be used in the COVID-19 pandemic, both for public healthcare workers and also to the common people. But the recent science and evidence shows that it is beyond doubt that universal masking is an effective tool. In fact, in a recent New England Journal of Medicine article, Dr. Monica and others have wrote that, let me quote it from their article, which has just appeared a couple of weeks back. They wrote that as SARS-CoV-2 continues its global spread, it's possible that one of the pillars of COVID-19 pandemic control, universal face masking, might help reduce the severity of disease and ensure that a greater proportion of new infections are asymptomatic. This is what they wrote. So there is a lot of study which is going on these simple procedures, although not really very simple, because wearing a mask, cleaning actually the hands, etc., etc. These are something issues related to the behavior. Changing the behavior of the humans is the most difficult part. So, but today we have the evidence that this kind of very simple, straightforward things can actually help us to prevent the infections. The hope of vaccines are pinned not just on infection prevention. Most of the vaccine trials include a secondary outcome of decreasing the severity of illness, since increasing the proportion of cases in which disease is mild or asymptomatic would be a public health victory. That is the victory of the healthcare system. Universal masking seemed to be reducing the rate of new infections, and we hypothesize that by reducing viral inoculum, it would also increase the proportion of infected people who remain symptomatic. Since there are a lot of probably industrialists among the participants today, the question probably which is actually in the minds of all of you could be how to apply these norms, whatever has been mentioned, for workplaces. The answers are straightforward. There are several guidelines which are given to that extent, but still, let me actually put them into perspective. The first and foremost measure is to include a 24-hour sanitation.
Excuse me, doctor.
Yeah. Yes,
doctor,
please.
this is Meera here. Sorry to interrupt you. That we are running a bit out of time. So because we want to have a short session on the Q&A as well. So if sorry,
Meera, I'm just concluding it.
Yes. Yeah? Okay. Thank you so much.
Yeah. So there are basically when we talk about employees twice daily, the temperature had to be checked. Providing face shields is important. Masks and PPE is important. Wash and sanitation stations is very, very important. Creating the physical distancing by erecting the barriers on workflows and dining facilities is important. whenever there is a sharing of tools, etc., wear the gloves, or do the frequent hand sanitation, which is very, very important. Having the staggered lunch breaks so that they don't actually mob together is important. And training actually the personnel about these measures is very, very important. Why I say that is, I see a lot of times the people do the hand washing just for the heck of it, right? Just in 2 seconds they complete actually hand washing. That is not the way. There are prescribed methods which are given by World Health Organization. When we are talking about with soap and water hand washing, it had to be minimum 20 seconds. When you are doing actually the hand rubbing with any sanitizer, it also had to be minimum 20 seconds in order to get that kind of effect. And also when people are wearing the mask, there is always I see a lot of people wearing the mask at the chin, or putting it as probably a kind of ornament on the neck, which is not the right way. It is not going to help. So one last mention which I would make, and then probably I would close it. Most of your industries and most of your offices must be running with the ACs. To the extent possible, please avoid ACs. And if it had to be there, please set the temperature to 24 to 30 degrees and humidity at 40 to 70 degrees. Allow a lot of cross ventilation. Avoid air recirculation, and to the extent possible, if it is a centralized air handling system, put more of the fresh air so that the people are safe within that premises. ICMR has given a lot of guidelines. You can go to the site of ICMR and you would probably can type something like ICMR guidelines on regarding air circulation, cooling, and air conditioning, and you would get all the details. Probably, because of the paucity of time, despite of the fact that I'm very enthusiastic to speak for more, but rather I would stop here and allow other colleagues also to speak. Thank you very much, and I am open to
Yes,
any of
thank
the
you,
questions.
Dr. Reddy. Thank you, Dr. Reddy, very much for your insights. I know that there's a lot to say, but since we're paucity of time, we'd like to also have a little bit of interaction with our guests. But before that, just some quick questions to Shiva, because we are wondering what the mask lab is. So maybe Shiva, very briefly, if you could just tell us, why did you start the mask lab? I mean, anything that prompted you to do this?
Yeah. So actually, I have an eye allergy, a dry eye allergy, which my doctor said is probably caused by pollution. So I have an air purifier at home, in my car, in the office, and that sort of thing. It's helped. But looking around, I see that there's a lot of general air pollution. And since our company actually works with a lot of different manufacturing environments in India, there's a lot of occupational air pollution also in industries such as construction, cement, and so on. And it's actually a genuine issue, maybe not at the level of corona right now, but it's actually a big issue. So I was actually interested in the mask technology, and we were evaluating it maybe about a year before the corona happened. Then of course COVID has happened, and that sort of pushed us to move faster and move ahead. And of course now there's a lot of manufacturers, but the thing is, the mask is also a technical item. There's a lot of technology behind the mask. It's about having the absolutely best quality, reliable raw material sources, the perfect manufacturing and quality control procedures, the right lab equipment so you can make sure that every single batch is perfect. And there are actually very few people who are making a quality mask, not only in India, but like I think even, China is a big global supplier, and we've seen that even most of them have not actually been able to match up to a certain standard. So there's a lot of technology behind it, especially behind the electrostatic melt blown layer, and the understanding is quite limited. So I think what we are trying to do is just trying to be a quality option for our customers, and since we're providing service to a lot of our industrial customers, we think we are contributing to their safety. And of course, I mean, at the end of the day, it was for air pollution, and we think beyond COVID, solutions to air pollution will also be necessary in the future. And that's essentially the basic story behind the Mask Lab.
Okay, very interesting. So, I mean, not really, I mean, you guys were ready even before the corona hit us, so you could accelerate when the need came now. Yeah.
Absolutely. So we were studying some things also, like whether it was UX or 3M, and some like there's a few guys who have a very high technology of mask, and we were looking at that.
Right. Okay. You also mentioned earlier, Shiva, that your workforce has been COVID-free despite working through the lockdown. So, I mean, any special advice on how you all managed this? To help the other companies, our guests who are listening in.
Yeah, I think we've had about 220 employees in our factories and about 330 fields and sales and service staff. From the office staff, there is a bit of work at home, and there were some restrictions anyways in the number of people who could be at office. But yeah, definitely our factories and our field staff have had to continuously work. So if I had to say three things, of course, I think Dr. Reddy Burri has actually covered most things. But if I had to give three things, the first important thing, my own personal experience when I visited the factory twice, was that everyone needs to buy in the culture and accept that our lifestyle will have to change because of the virus. So in our own company, we noticed that people were accepting the mask probably because we are manufacturing it and they had no choice. But we noticed that in spite of that, everyone is eating together, and then they're taking tea breaks together. And I mean, I had to explain to everyone, and again, to the factory people and everyone, that COVID doesn't take a lunch break. So it's not like, okay, we've sort of worked hard and now we're going to all relax and share some food. So I said, this is something that's very important. Even in our own offices, there's been a big problem because everyone is used to working with air conditioning, and the tendencies to, I mean, obviously it's more comfortable, So it's also a bit of a mental challenge to keep the windows open, let the airflow out, put on the AC just for a little bit, have a staggered seating. So I think everyone is going to have to make some changes for the virus. I think our main takes was obviously that everyone should wear a good mask, or the proper fit of mask. It's not just important, and you need to have a high quality of standard of mask, which needs to have a good fit. That's very important. I like Dr. Reddy said, like there's a lot of masks that I've seen, even if you wear whatever, if it's below your nose, it's really not going to help. I just can't see that doing anything. If it's loose, you're still not going to help you, and you're not going to protect others. I think proper spacing between employees and staggered meal timings, of course, hand washing, and no bottlenecks such as handles. So what we kept is we've kept a lot of the doors open, and that I was saying open doors, so that people are just less touching things. What we realize that people are, I wash my hands, then we're all touching the same taps, and we're all touching like the same soap dispensers. We kept some automatic soap dispensers, and we kept some these things. So there's some things we had to change up. Then we also kept some of the doors open in many of the different areas, so people don't have to touch it. The second thing, what I feel is that, from our own experience, to eliminate the unnecessary procedures, because that's the only way you'll get compliance with the necessary procedures. So, we had stuff like, even we bought a sanitization tunnel right in the beginning because we weren't sure, and we immediately understood it's a bad idea. We scrapped it. A lot of people are wearing masks sometimes all the time, even when they're open or they're driving alone in the car. This is pointless. So, you don't have to wear a mask at those times. Wear the mask when you have to wear the mask. Don't wear it when you're in the open and you're not close to anyone, and it's there's a strong ventilation, or you're not in a crowded area. So I think that people have to take a close look at the unnecessary things that they're doing and eliminate that. And the third thing, which I think Dr. Burri has said, is that definitely you need to increase the air circulation. The ventilation is actually quite important. That's what we believe. If you can't increase the ventilation, then you need to wear stronger protection. Whether it's a higher level of mask, go from a surgical to a FFP1 or a FFP2, or maybe like some other different measures to protect yourself. Maybe like get fresh air into the AC instead of recirculating the air constantly.
Right.
So
Thanks a lot, Shiva, for that input. And I mean, actually, we have a lot of questions coming in from the guests, and maybe this last question to you might also answer a lot of the guest questions, which is, what mask do you recommend for people going back to work? And after that, after you're done, Shiva, we'll just take a quick poll and then quickly jump into the audience questions. So just a last address from your side.
So which mask would I recommend? Okay, so I would recommend the medical grade surgical masks, which are conforming to the ASTM F2100 for general people, for almost all office and factory workers, or for general use. These give a pretty high degree of protection. If they're worn properly, still pull it below your chin. Make sure you bend that nose pin. I've seen a lot of people never bend the nose pin, so there's a lot of leakage around their thing. You got to do a quick check. So if you wear glasses, sunglasses, whatever, it should not fog up. That's a very quick sign to understand if the mask is tight and properly worn. And I think that this, just a medical grade surgical mask conforming to ASTM 1 will give you a lot of protection against pollution, and not only protect the wearer, but also protect a lot of colleagues. Obviously for those people in a high pollution environment, where the FFP1 or the FFP2, if it's an open situation where you can wear it with the exhalation valve if you're working outdoors in construction, in anything else. And obviously that is where the respirators have originally come from. For the medical workers, again, I would recommend a FFP1 or FFP2. You want something that's tight fitting, where there's very little inward air leakage. That is the most critical aspect, more than the particle filtration. It's got to be a very good fit. And it could be maybe some of the staff on the outside, the receptionist or something, could wear a surgical mask, a medical grade surgical mask. But for most of the people in the hospitals, the doctors, I would really suggest a FFP1, FFP2, N95 type mask. For those people also who are working, especially outdoors, if there's a bit more physical work, working longer shifts, even in the medical environment, especially with the FFP1 or FFP2, we feel that a lot of people have a little bit of, they find it difficult to breathe in these masks. So you want to go for the low breathing resistance mask, which you can get also. And that actually makes it much easier to breathe in these masks for an extended period of time. And I think even cloth masks have a space. So for people who are in a more open environment, it's quite well ventilated. You can take a look at that, but you have to get a good fit of cloth mask. And this will actually, more than protect the wearer, it will protect you from spreading the virus to some extent to other colleagues. But again, like, I would restrict it to certain environments. And definitely, like, there's a lot of 3-ply masks around. I don't really see the purpose of it because it doesn't have the comfort of a cloth mask. So I would recommend the cloth mask if you just refuse to wear a surgical mask. So there's no point of having a 3-ply mask. So I think either you've got to get a medical grade ASTM conforming mask, or go for a cloth mask. And obviously, if you're in a higher risk environment, go for a FFP1 or FFP2. And then, in a low ventilation environment, if you can't get the thing, or you can't improve the ventilation of the enclosed air condition, again, a FFP1, maybe FFP2 mask. And then going back, I think that all masks will give you protection from at least touching your nose and your face. So that's a positive in every given situation. Got to look at the fit of the mask, and it's going to prevent you from touching your face. So those are my tips.
Okay.
That's what I would think in a couple of questions.
Thanks a lot. Thanks a lot, Shiva. We'll quickly get into one poll. So Sana, can you run the poll? And after that, we are going to get into the questions from the crowd. Just again,
can I just repeat one thing though? I think there are some
so that we
attachments
can
that were there.
respond to as many questions as possible. Okay. Yeah, so those you wanted the guests to have downloaded, right? That we'll just have that.
Absolutely.
But no, I'm sorry, just repeating my request is because we have a lot of questions, and so that we can handle as many as possible, I'd request the response also to be brief. So, we don't have guests feeling that they've attended the session, but their question is not answered. Yeah. So, Sana, So maybe Shiva, you have some comments on the poll results as well?
Yeah, so again, like I said, I think cotton masks don't provide necessarily a great deal of protection against. It depends on the airflow, and this is the calculation would depend on that. But you would expect something like 50 to 60% of particles between the 0.3 micron range to actually penetrate through. About 60% is what I have checked in some studies abroad. So that's a bit of an issue with the cotton mask, but of course they're quite comfortable.
Okay, perfect. So now we can get into the Q&A from the guest. So Monaz, you can take that on right now. Thank you.
Thank you. Thank you very much, Meera. Thank you, Shiva. Thank you, Dr. Reddy. I will try to keep it as a rapid fire question round because we have some wonderful questions coming. And Shiva, you have answered a lot of the questions that were there. But I'll start without any delay. First one, can mask be reused? If yes, then how long?
Okay, I can definitely answer this. So I think the important thing about masks is that when they clog, that's when you find it slightly difficult to breathe through them, that's when the mask cannot be reused. You can reuse surgical masks. I use my own FFP2 mask for like about a week at a time, but I only use it for maybe 2-3 hours a day at maximum, because it's when I'm going out sometimes, not every day. So and of course the air is quite clean in Bombay right now, so you can reuse it. But what you need to do is you need to rotate your mask normally. So you use one mask one day, keep it aside carefully, don't touch it, and then use a second mask for the next day. That's what I would suggest. If you're in a medical environment, if there's any sort of aerosol that you've been exposed to, then you have to discard the mask every single day.
Thank you. Thank you. Moving on,
Just to
employees in manufacturing industries and organizations where social distancing is difficult, could you suggest a name of a nose mask and a face shield? What is recommended? I think that they're looking for some names or some particular type.
I mean, I don't want to self-market. Obviously, we make a very good mask. That's a consideration. I think obviously 3M and Venus are the other two good manufacturers here. Honeywell also makes a very good mask. UX in Germany. So these are the good guys who've also got a good quality control procedure in a lab. Face shield, I really don't think, like, for a regular worker, a face shield is frankly useful unless you're exposed to a spray. That's my own view, but I don't know. I think, like, for a regular person who's at office, like, you really don't necessarily need a face shield. What you need is a good mask.
Okay. Dr. Reddy, the next one I think you can take. When does an infected person become contagious?
Before answering this question, let me just quickly add to what Shiva has said regarding the mask reuse. Okay, mask reuse would depend on two major factors. One is the risk, means the kind of environment you are going to be in. Okay, that is the first parameter. Second parameter is, whether that particular mask has become wet. If it has become wet, it is immediately you have to throw it out. There is no way you are going to reuse it, because the moment it becomes wet, all the properties of filtration would cease, and hence, the moment actually it becomes wet, you immediately have to throw out. Yes, generally all the masks are supposed to be single use. That is what actually it is. But considering our pandemic times, and also the scarcity of the masks, especially in the healthcare system, reuse is allowed, provided you are going to give the sufficient time between the uses. That is, let's say, if today you have used, at least it had to be kept out in a brown colored kind of paper bag for at least 72 hours. Ideally, it is 5 days, in order to ensure that it doesn't have any of those infectious agents sticking on. So that is what it is. And coming back to your question, you have asked about the quarantine,
Yes,
right?
no, I'll just repeat it. When does an infected person become contagious?
Contagious. See,
Yes.
I think, I talked about it. There are three kinds of scenarios with infected person. They can be pre-symptomatic, post-symptomatic, or asymptomatic, right? So from the moment actually the microorganism enters into your body, it starts immediately proliferating. Within few hours after actually your body got the entry of the microorganism, you start actually spreading mostly through the droplets. And also, when you are going to actually have the contact where you are going to touch the surfaces with contaminated hands, and then you are going to uh, kind of infect others. That means from the moment actually the patient becomes infectious, immediately they start becoming the transmitters.
Thank you, doctor. Next question is, I think, for Shiva. Please advise if it is necessary to wear the N95 mask or any normal mask cloth would suffice. And actually, there's another question also which I'd like to club about the cloth mask. I find wearing cloth masks comfortable. Are they safe to wear?
So I think that the issue is there are three issues with masks in general. What we understand, one is a cultural issue, which is that you have to put it on your face, and people don't like that. The second issue where people find N95 type masks or even surgical masks uncomfortable is they feel that it's difficult to breathe through. So better quality masks do have low breathing resistance. I mean, for example, we make a low breathing resistance mask. I know the 3M N95, which is imported, also does that. So there are low breathing resistance masks around, and you need to make sure you get comfortable masks, especially if you're going to wear it for an extended period of time. Cloth masks in general, I've not seen them fit properly. So if there's a lot of air leakage, it's going to be easy to breathe because you're breathing the outside air, but it's not going to give you the protection. Then this is like, I'm doing it because I have to do it. So you have to decide between protection, and you have to decide between I'm doing it because the government has told me to do it and I can't, do anything else. So I think cloth masks, like I said, they've got a space in an open, well ventilated environment. They're not going to necessarily give you that level of protection you require. They don't have an electrostatic melt blown layer, so they don't have a particle filtration efficiency, which is worth anything. And definitely, I wouldn't wear them indoors in an air conditioned environment, that's for sure.
Okay. I don't know who would like to take this one. Do you recommend UV light at office premises?
Not, I don't think that UV light is dangerous, but I think Dr. Burri will answer that better. But it's very dangerous because we use it in some of our inks to cure them, but I would not fool around with UV lights.
Okay, and similar to UV, can you use a mask for many days by sanitizing them in a UV box for 5 minutes every day? Perhaps a yes or no answer.
No, I don't think. From what I know, is the only way you can sanitize a mask is using
Well, let me actually, pitch in here. You can do sterilization of the mask with hydrogen peroxide vapors. We call it as the plasma, hydrogen peroxide plasma sterilization, which is, there depending on, who is the manufacturer. The manufacturer gives the duration which is required in order to sterilize the mask. It is usually something like 5 to 10 minutes. And then there is also a way of sterilizing through the steam, right? Even a simple pressure cooker can actually create a steam. You can actually steam it for something like 20 minutes, again, depending on who is the manufacturer and, what is the kind of material they have used. So around 20 minutes to 30 minutes steam sterilization is also going to help. As far as UV is concerned, definitely it is useful. There is no doubt in that. And coronavirus or any other virus, usually they are very highly susceptible for the temperature, for UV rays, and for even very basic chemicals and the detergents. And hence, actually doing sterilization with UV is okay, but only the thing is what kind of UV sterilization, because not all the UV sterilizers who are in the market really conform to the standards of the UV wavelength which is required in order to achieve the kill rate. So you can do that. And in the clinical settings, nowadays UV robots are being used in order to do the disinfection of the places. Again, there is something called as contact time. You have to have the contact time. You have to ensure that the people are not going to roam around while you are actually doing the disinfection with the UV rays.
Thank you, doctor. There is one question on the mask. Is it safe to use mask with filters, ventilation filters? Shiva, perhaps you could comment.
On exhalation valves, so again, it has to be in an open environment. I actually recommend it if you're working outdoors and you're doing a physical work, you would need exhalation valves. But for COVID specifically, in an indoors environment, you cannot use it. So because it'll actually aerosolize the virus, so it's actually more dangerous than being without a mask.
Yeah, just adding to that, actually, the government of India has come out with a government order that you cannot use with the walls. That is banned currently during the COVID-19 period. Post COVID-19, maybe they can reappear, but as far as the COVID-19 management is concerned, for the public spaces, you cannot use with the walls.
Okay, thank you, doctor. Perhaps the next one you could also comment on. What are the chances of a person who has already been infected and developed antibodies in his blood getting infected again? Is the person safe for a couple of months?
Well, it all depends on the kind of antibodies which are being produced after getting infected. If they are in good number, definitely your protection is going to last long. Usually, once actually you get infected, the antibodies are going to remain for some time, something like because the disease pattern what we have seen is maximum of 6 months only. Means we have the history of only 6 months actually observing these patients. So typically we see about 3 to 4 months actually these antibodies remaining in the circulation. But we cannot say that only when antibodies are there you are safe. There is something called as humoral immune system. That means there is something called as a T cell which also get activated, which also provides you the immunity. So yes, antibodies are important, but at the same time there are other immunological processes which come into the picture when it comes to the providing the coverage is concerned. Yes, there is a possibility of getting reinfected. We also have seen already some of the reinfected cases. It started in South Korea. There are about reported 5 to 10 cases. In China, there were some cases which were being reported. From Europe, we are also getting the news of reinfection. In India, so far, we have seen only in Delhi few cases and in Hyderabad few cases. But we need to validate those cases, whether in the first case they were infected or not. So there is a possibility of reinfection.
Thank you so much, doctor. And as we say, we leave the best for the last. Final question to you, Shiva. Where can we buy the Mask Lab mask? Where can we buy it?
Yeah, so you can get it online on Amazon or Flipkart or something, or you can contact, it's right here, Gautam at themasklab.in, and he will definitely refer back to you.
Thank you so much. So with this, we close the Q&A for the moment. All the questions that are still not answered will be sent to you, will be emailed to you. A quick thank you to Dr. Reddy for taking out your time, and Shiva for coming on board, and the whole Mask Lab team, Gautam, Apurva. And I can see a lot of attendees are logging out. So please don't forget to download the handouts which are there on the corner right-hand side. Before you leave, please do take them. They are all the information that you need. On behalf of IGCC, we wish you a good evening. Take care, be safe, your family needs you, and please stay tuned because IGCC is and it continues to be there for you and come up with new webinars. Our next one is next Thursday on recent developments in customs and GST. So please stay tuned and thank you once again to the IGCC team, Meera, Sana, Phyllis, Dorel, Honey, and we wish you all a wonderful evening.
Yeah.
Thank you, Dr.
Absolutely.
Shiva.
Thank
Dr.
you all
Reddy.
for your time. Thank you, Dr.
Thank you,
Reddy.
Gautam.
Thank you, everyone.
Thank you very much, and stay safe, guys. Keep yourself protected, and let's hope this pandemic is going to end soon.
Truly.
Absolutely. Absolutely.
So logging out.
Yes.